Hello, everyone. I'm very happy to have a Selective Mutism expert, psychologist, Dr. Vera Joffe, with me today. And Dr. Joffe is going to answer some frequently asked questions from parents of children with selective mutism. And all the questions she answers today are from parents in our Selective Mutism Association of China Parent Support Group. Thank you, Dr. Vera, for being so generous with your time.
Thank you for having me.
Thank you. So let me introduce Dr. Vera Joffe, her background. Dr. Joffe has a Master of Arts from the University of California, Berkeley. She has a PhD in psychology from Iowa State University. Dr. Joffe is a board-certified clinical child and adolescent psychologist and certified therapist for parent-child interaction therapy, PCIT International. Dr. Joffe is a selective mutism expert. She served as a member of the board of directors of the Selective Mutism Group for 4 years. She is a member of the Association of Behavior and Cognitive Therapists and the Selective Mutism Group and AADA. Let me recommend the picture book by Dr. Joffe called called Sophie's Story. It is a story about a little girl named Sophie. She has selective mutism, and the story follows the life of Sophie and what is her difficulty in school and in various situations. And Dr. Joffe used the form of a story to show the parents of children with selective mutism and their teachers and all their loved ones how to help children with selective mutism to deal with life situations. And this book has been translated by volunteers from our Selective Mutism Association of China, Zhang Yan, Nianhua, Junhua, and the Chinese version of the book will come out on Amazon soon, and it will also be published in China. Let me read Dr. Joffe's disclosure for this interview. Dr. Joffe is very pleased to participate in this interview when she answers questions from parents. She would like to inform you that due to the nature of this presentation, she will only be able to make some recommendations in general terms, and that her suggestions will only be based on the information given to her, and they are not a replacement for professional relationship, diagnosis, and therapy that families may be obtaining or that are recommended to obtain. Dr. Joffe cannot make any specific recommendations, make any diagnosis, and provide treatment during this presentation. This is an educational interview where Dr. Joffe hopes to help parents face barriers and seek solutions, strategies, and further professional help when necessary for their children. For more information on Dr. Joffe's professional services, you can go to her website, www.verajoffe.com. Dr. Joffe, could you please tell us how did you start working with children with selective mutism, and describe to us what are the key to help selective mutism children?
Thank you. So I have been doing this type of work for more than, I think you have do you have the, did you pass the microphone to me? You are still going around you.
So you are speaking, it's not mute.
It is recording, me too, right?
Recording. It is recording.
Okay, thank you so much. Sorry about that.
Okay, we just want to make sure. We can cut. It's
Thank
okay.
you.
Yeah.
I have been working with selective mutism for over 20 years. The first cases I started receiving here when I moved to Florida were new cases. We hadn't been trained in psychology PhD program on this area. It was considered elective mutism, and there was very little known about it. And I started then obtaining more information because I wanted to know what I was supposed to do. And with that, I started doing research, and I also joined the organization. And we started as a group developing ways to find out what would be the best treatment and building up empirical data information. So with all that in mind, my approach to any child is neurodevelopmental. We need to see the child, see where the child is developmentally, how old the child is, the strength, the weaknesses, and we need to look at all the other functioning too. And then we decide, depending on the age of the child, what approach we're going to use. Of course, behavioral therapy for children who are younger, cognitive behavior therapy for older children, and we all now have the protocol for selective mutism based on parent-child interaction therapy. But more importantly, with all that in mind, these approaches are best used and utilized, and they're more effective if they're done at school or if they're done in public. They're done where the most difficult time and place situation and with people that the child is having. Working from the office is not enough. It's important to have exposure exercises where the issues happen. And that's most of the time in school, not all the time, but most of the time in school. Could be at a ballet class, it could be a restaurant, it could be with family that they don't see very often. So basically that's the approach that we use, and there is more research now coming out, and so my work is based on research and on those frameworks that I think are important to take into account when working with children. Okay. So I would like to provide to the parents, and first of all, thank you so much for having me speak with the parents from all over the world, and especially in China, and your work in terms of giving information for parents and professionals and everybody. So it's the step number one psychoeducational approach to helping families and become more informed on what are the best things to do. With that in mind, today I would like to be able to give parents and professionals, whoever is listening to this, one piece of or a tool to use after we are done. So I would like everybody who is listening to this to get a piece of paper and to write place, person, and activity. And write a place where your child speaks, a person that your child speaks most of the time. So a place would be home, a person would be mom and dad. And then activity, what is your child's favorite activity at home? And other activities that your child does at home. And then I'd like you to write places and people and activities that your child does not communicate socially, verbally, mainly verbally. So I'd like you to have your ultimate goal, which is for your child, of course, to speak with everybody and at all places, most places, not strangers, but most places, and doing most activities. But I want you to think about the first step that you want your child to take, the easiest one. Would it be with a new person at home? Would it be at school or a park? Would it be where? And I would like you to pick the activity that your child likes to do the most and put in that column. So that will be your first step. And I want you to start thinking about how you're going to go about doing this. This is not like I'm not giving slides for you to use, but this is the only slide that I'm giving, and another opportunity. I'd like to work with those three elements and how to plan for this. So if you are watching this video and you want to come back later on when we can use your information to get another video, another time that we share, I can work with that with you. But this is the frame that I would like you to start using as a parent, okay? So let's just start with that, and I hope that will work for you by the end of this time.
Thank you so much, Dr. Joffe. So we're going to start answering parents' questions soon. Okay, Dr. Joffe, we're going to start with the first question. And in this question, the parent says, my daughter is 4.5 years old. She has been silent in school since she started school 2 years ago, and I didn't know anything about SM until March 2019. She participates activities at daycare and started to participate in activities in extracurricular classes, which are English and art classes. And in art class, she was too nervous to hold the pen in the beginning, but later she could do it. She participates in English class, but still cannot answer the teacher's questions. So this parent's question is, how to choose extracurricular classes for SM kids? And I'm wondering if language classes put more pressure on SM kids, and are art and sports classes better than language classes for SM kids? And the second question for her is, after my child can answer questions, what can we do to encourage her to proactively ask for help when she needs the help?
Thank you for your question. So I'm going to comment on your question first. I am sorry to hear that it took 2 years for you to receive the help that you needed to receive. But don't feel bad, because most children are not diagnosed when they first show the symptoms of SM. That's why being part of this organization is so important, because you're going to help other parents be aware of it before too long. But no matter what, you are getting a good start. And you have some things that you said that it's very good that you are putting your child in an extracurricular activities. One of the things that I notice is that she's too nervous to hold the pen. And for me, as I said before, I cannot make any assumptions because I don't know your daughter. But a child who is 4.5 and I don't know what kind of pen she's being given, if it's a thick pen or a thick crayon, or if it's a thin pen, if she doesn't have the fine motor skills, and if she may be a little bit perfectionist with that, I would kind of look and see what is going on that she's too nervous to hold that, because a lot of kids are very conscientious if they hold the pencil or the pen differently. I don't think a 4.5-year-old should be using a pen. But keeping that in mind, I think that we need to check and see what that is all about, because at this point she may be drawing or coloring and having fun. Now, it is important to choose extracurricular activities, and I like that you're doing that in school. And you asked about the classes. I think that there's no right or wrong classes extracurricular. But of course, if you chose art, and if she has any difficulties with holding or with painting or anything, and she is too aware and she gets nervous about that activity, I would choose something that she's more comfortable with. Or I would choose this and ask the teacher, because we always have to educate the teacher about SM. But I would ask the teacher to spend some time alone with her and have fun and make mistakes and paint with the fingers and do something really creative that is fun and is not necessarily academic. So the sports, some children do really well with sports, and some children like sports. I think that the most important thing is to do something that she likes. Then you asked about language. Of course, if she is having to use communication, verbal communication, the whole day at school, and then afterwards she's into a language class, that may create anxiety for her. So I would do something fun. And remember, I will go back to that model that I talked about, an activity that she likes. What does she like to do at home? If she likes to do something at home that they have something similar at school, go ahead and do it. And then you ask, what are some of the things that you can do to help? I think that when she needs help, first of all, when she starts answering questions, that's what we say, a, you know, a verbal response. So the next step would be for her to initiate communication. That's according to Dr. Shipon Bloom's scale and bridge of communication. So if there are two areas that for sure right now, since she's not speaking in the classroom yet, we need to address, and I addressed that in the book that you so kindly found ways to translate into Chinese. One of them is bathroom necessities, and the other one is when they get hurt. I have kids who do not use the bathroom the whole day that they are there. Once they have anxiety about in the bathroom with other children or being alone, but they also don't want to be on the spot and they don't want to ask to go to the bathroom. So many classrooms for a 4.5-year-old, they have the bathroom there, and if they don't have a nonverbal way of asking the teacher, I would develop that with the teacher. And also for after care, if your child is doing after school activities, I would do the same. And the other part is I have kids who really get hurt in the playground. They don't even cry in front of the teacher because they don't want to. What's the first thing they're going to say? What happened? And they won't be able to say. Or they don't want to go to the nurse's office if they're older. So it is for her to get help in those two areas even before she communicates. Afterwards is where the intervention starts. Now, how can you proactively ask for help when she needs it? You know, ask for clarification or something else, that's later. I would focus on those two situations first, and I hope I answer a little bit of your question.
That's very helpful. Thank you so much, Dr. Joffe.
Thank you.
The second question from our parent is, my daughter appears to be quite extroverted at home. After 2 weeks intervention, she can now answer questions. Therefore, I believe she doesn't have severe case of SM. With continued intervention, will she become completely normal in the future? And the second question is, my daughter can answer questions from stranger in open public setting, like in a restaurant or in a shopping mall, but she uses a suppressed, hushed voice, which is different from her normal voice used at home. Is she considered to have been desensitized in these situations, or is there still a long way to go? Please.
Thank you for your question. I think that you touch a lot of topics that I could talk for hours about. So all of the questions actually. The question is if your child will be completely normal. The question of normality is not something that we discuss in this context, in that we talk about selective mutism, which is a diagnosis and is a neurodevelopmental condition. It is in the DSM-5, it's a psychiatric diagnosis, but I see it as a neurodevelopmental diagnosis. So we look at this, and when do we diagnose a child with selective mutism is when the child is showing impairment. So instead of talking about normal and not normal, let's talk about impairment. If your child is showing impairment in those certain situations, then she's suffering from it, either emotionally, socially, educationally, then we attribute a diagnosis. Somebody may have symptoms that are not so different, but they're not having any, it's impossible not to have impairment from them, but it's the impairment that we see that we need to address it. So in terms of your question, you mentioned that your daughter has had intervention for 2 weeks and she's already answering some questions. And I'm very happy to hear that, because I hope that your child is receiving intense intervention. Intense, what I mean by intense is every day or twice a week, and a lot of in the office and almost every day at school, with intervention given by the therapist, by the parent, by the teacher. I tell parents to have play dates more than you want to have, especially now in the summer. have a lot of recommendations for the summer. So I think that your daughter is functioning in a much better way than she was when she first started intervention. So congratulations for doing what you're doing, and continue doing what you're doing, because it is working really well. So we know that if we give intervention that is appropriately done, an intense manner, that it will work. Now, in terms of, there are a lot of variables that may play a role in more success of therapy. So one of them is the parents, the teacher, and other people contributing. So let's talk about the fact that she's already answering. And again, I don't know your child's age, unfortunately. And next time that we have questions, when we have new ones, it would be really good for me to have. I cannot answer specifically, but at least I can make some recommendations that are more age and developmentally appropriate. So in this case, it's not uncommon to have children speak in a different voice, either lower voice. Sometimes they speak in an infantile voice. So it's not that uncommon for children to do that. So what happens is, what I would recommend, remember the 3 elements that I talked about at home, playing with your child, depending on the age of your child. Prepare and rehearse to go to a restaurant, for instance. So in a public place, and you practice. What I tell parents is to download the menu of the restaurant where you're going, so that you can practice and play games with the child in doing that. And then you reward her for using her own voice and for projecting her own voice. So once you do that, and you do in other places, and you can have actually a behavioral kind of program where you're going to reward your child. Suppose that your child likes to go to a specific, store. They go to Walgreens. I don't know if you live in the States, but if they go to Walgreens and they get this little thing for their collection, and if they say something even to you, if they are saying something to you, and then they're going to say something later on to the person asking for a specific item, or to even say thank you, or to ask for direction or something like that. Where are the brushes, or where is the nail polish, or so then you will buy that item for your child, and I hope it's the dollar store or something like that. I don't usually recommend necessarily having a reward every time, but I think in this case you can plan that activity and see how it goes. Of course, your child uses that voice because it's a way of it's handling their anxiety, but the more exposure you provide, the better it will be. Now, there is the question that you have, is my child desensitized in the situations? That's a very good question, because your child has not been 100% desensitized, because at school she's just answering questions. She's not volunteering information. And I think that the point that you brought that is really important for other parents to learn from is the fact that it's not just when they speak, but it's the nature of their voice and how they communicate, which is the language part. That's why Dr. Shiplon Bloom too says it's just not speaking, it's the communication and language that we talk about. So it's really important to know that you're not done yet. You did really well over the 2 weeks, but we need to continue moving. And in my opinion, success of treatment is when children use the same voice they use at home to use in public situations. But by the way, at home, some of the children with SM speak very loudly and they talk all the time, which is not appropriate in public. So it's a toss-up, but I think that you're doing really well. Congratulations in starting whatever intervention you're doing, and keep on working and exposing your child all the time.
Thank you so much. These are wonderful ideas. I'm sure our parents will cannot wait to try your strategies.
Thank you.
Okay, Dr. Joffe, let's start the third question from our parents. This is a case where our parents wonder, should my child change school? Specifically, my daughter is almost 4. She has been making tremendous progress with brave talking everywhere, but is still struggling with talking in her preschool Montessori. She can talk to teachers on a one-on-one setting and has a friend she can talk with, and she loves this friend very much. But she cannot talk when all kids are in the same class, in the same room. The school is not doing anything to help her with brave talking and has poor communication with us. We now have the option of going to another school that could help much more with brave talking, and is more play-based and has daily communication with parents. But switching school would mean that my daughter has to start from scratch all over again. So my question is, would you recommend my child to switch school or stay at the current school in my situation? Dr. Joffe.
Thank you. Thank you for your question. I think that you address a very important question. I often receive this question. I just had a meeting in my office where we spoke about end of the year, making decisions about next year. I think that, first of all, you're right that your daughter made tremendous progress. She made tremendous progress outside of the school. So she has this friend, and if this friend is from school, that would help. But you have several questions. First of all, I want to say that I'm very much familiar with the Montessori system. My children, as preschool children, went to a pure Montessori school in the Midwest. And so I think I'm very much in favor of it. I just think that there are two items that you said about the school, that they are not open to receiving you to work with them, although she is speaking one-to-one with the teacher. I think that it's a very difficult decision to change schools. We're in the end of the year, and she's 4. She's almost 4, so she probably is going to a 4 or 5 VPK, maybe if they have where you are, which is before kindergarten, if you would live in the States. But if you think that, and it sounds like you did your homework already, you went to the school and you spoke to the staff, and that's what I was now before this meeting, having a meeting for the next year with the child. If you have an opportunity, I would go to her current school and I would ask a professional if they could have a professional come and do an in-service for your school, for that school, the Montessori school. If they say, no, we're not open to this, it interferes too much with the rhythm of the school or whatever, then I would think that, it's really important to think about another school. This other school that you have, I would definitely contact them now. I wouldn't wait until August to enroll your daughter and then find out about peers, find out about teachers. I would start bringing her to this school now to visit. If they know who the teacher is going to be next year, I have one child who is doing that now, actually at a Montessori school here. But he's visiting, or she's visiting, his future teacher, who will start teaching him only in August, but he's already becoming familiarized with her classroom and with her assistant. So I think this is one thing that you can do. And also, if possible, there are all kinds of regulations depending on the school that you go to, but ask for names of children who attend the school and try to enroll your child in activities that are close to that other school, and ask the parents where they're taking their children. Just to give you a recommendation, I have one parent, and I'm very proud, she published something in the organization a few years ago. I recommended her to invite all the kids to her house during the summer. She created a summer camp in her house. One by one, she invited all the kids, and then her daughter started talking to all the kids during the summer, because she knew he was going to be in her class the next year. So then it was much easier for her to go back to school. And then before school starts, your child should go to school and get used to the situation, the teacher, and have a one-to-one meeting with that teacher a lot before. I have a lot of suggestions for the summer, like, sending videos, communicating with the teacher via video. But I want to tell you one thing too, that nobody can guarantee that your child will be speaking at a new school. The change of school doesn't mean necessarily that your child will be speaking there. I think that you have done a lot of interventions on your own way to do it. But when you find barriers and they not depend on you to break, then find new solutions, okay?
Mhm. Okay, thank you. Start question 4. In this case, the parent's question is regarding how to help their child to speak at school. The question is from Sami's mom. She said, "My son is almost 4. I just came to know about SM this February. I've been taking my son to therapy once a month, and I've been applying what I learned from books and other parents in this WeChat in our SMAC WeChat SM parent group. So far, my child has made big progress. He can talk to his friends at school, but only nods and shakes his head to his teachers. He doesn't directly respond to people he doesn't know well, and depends on me to relay what she wants to say." So Sami's mom's question is, what should I do to help my child so that he can answer the teacher's questions at school more often? And the second one was, what should I do to help my child so that he can read and sing along with the class? And I know pretty sure that he is capable to do so because he reads and sings with no problem at home. Dr. Joffe?
Thank you for your question. First of all, one of the details that I noticed in your question is that you're taking your son to therapy once a month. And that is kind of a red flag for me because, as I said before, intense intervention is really important. But I'm really happy that your son has showed some progress. And I think a great part of it is because you are doing your homework too. And you are the most important agents of change, the parents, because you're exposing him to all the situations. Still, if you are going to take your son to therapy, it would be best to take, like, suppose you can afford to take your son to 10 sessions for 6 months. Those 10 sessions shouldn't be spread out. They should be together. And then you can learn how to develop those strategies from your son's therapies. So that is my first approach. And the therapy that he should be receiving, if he's 4, is parent-child interaction therapy adaptation, and also at school and in other places too. And they should be going to school to educate. If a psychologist or whoever is treating doesn't go to school to communicate, then this is not going to work very well. It's better to go to school. So I recommend more intervention. For that, I also think that you use another word that is key. Your son depends on you to rely what he says. I try to come up with parents of children who are 4 with strategies that are like, we don't even know. I have parents like that, they assume that they know what their child is thinking and wants. So if you go, for instance, to the yogurt place, and you know what your child likes, but don't assume that you know. You can ask your child a forced choice question, which we can explain, or you probably have videos of PCIT for, parent-child interaction therapy. But a forced choice question is going to the yogurt place and ask, do you want strawberry, vanilla, or something else? Knowing that your child may like strawberry or vanilla more. If your child likes another one, your child may choose something else. But you just ask and look away. But you can practice that at home too. And you can say, like I said in another example, see, parents can help each other come up with situations. You can ask that, you can practice at home, and then you can go to the yogurt place and help that. In terms of the school, how do you do that? the three elements that I talked about. So you're going to look at an activity that your child likes to do at home. I sometimes play headbands with children. 4-year-old is too young for that, but we play games that are appropriate for this age. And then if they feel comfortable with that, if I'm the intermediary and not the parent, if I'm the one, then I go to school and I'm playing with the child and the teacher is behind us. And slowly the teacher approaches us. Very slowly. Sometimes it just takes one session. Sometimes it takes more than a session. Because the minute the child sees the teacher, the child stops playing or talking. But we have to keep going and we have to still do it. Now, that second example is a very good one. Most children, when they get home, they like talking nonstop. They tell everything that happened. They sing all the songs. They know their ABCs. And the teachers think that they can assess the child. So I recommend making a video of your child singing the songs. First, I always ask the teachers to send videos and see, and the music that they're singing at school in the beginning of the year to the parents so that they can play in the car and they can play at home and they can play school and the child is a teacher and the parent is a student, especially if English is a second language so that the children get used to singing those songs, but not just for parents whose English is children whose English is a second language. But then I would send a video of your child singing. And just the fact that, and then you let the child sit with the teacher and listen to the child singing the song at home. Just exposing your child to the teacher listening to his voice in front of, your son will be a desensitization exercise. And the child will feel more comfortable. We don't want to put it like in a video, like on the wall for all the kids to watch it right away, because that's a flooding experience of anxiety, maybe. But it's important to start with the teacher, and the teacher will hear that, and then start sharing with other children, ask another child to come, and then start exposing that way. So we know that your child is capable. Most parents get very upset when the teachers, by the end of the day, they said your child cannot be promoted to kindergarten or this, we can't assess it, and they have to assess it for the programs, but the parent gets very frustrated, and this is one way to do it. There are certain tasks that the parents cannot do, that the teachers don't allow the parents to assess the child from home, but there are some other things that can be done. But thank you for your question. That was very good.
Thank you so much for your thoughtful answer. So helpful. Vera Joffe, our question 5 is about how to reduce fear of children's fear about teachers. The parent's question is, my child is in preschool. She is so nervous when the teachers are around that she isn't able to speak. In the past 3 years, she only answered questions from the teachers only a handful of times. She does not talk in extracurricular classes, but sometimes she acts silly. Currently, she talks to classmates when they are outside of school. She is going to an elementary school this fall. First question, what can we do to reduce her fear of teachers? And second, we are moving soon, and my child will start elementary school in the fall. What can we do to prepare her for the new environment?
So thank you so much for your question. And again, this is another case where I'm really sorry that your child isn't receiving intervention, so soon, that it took a long time to take the intervention. And it is our responsibility to educate the teachers and everybody to doing this. And that's why this organization is so good, that I hope a lot of teachers in China and other places will listen to this. So I usually, I think that, that your child has had some movement, but not a lot of movement over the last, so many years, and your child is so young. So one thing that if I assume that now is the end of the school year, but she currently talks to classmates when they are outside of school. And if you were to stay, but you were saying that you're going to move, but if you were to stay in this program, if you're going to stay during the summer, every day counts to develop interventions, even if you're not going to stay there. I think that if you're going to stay there during this part of the summer, the end of the school year, I would make a lot of play dates with the kids that she talks to outside of school, and then I would get closer and closer to the school. For instance, if you have a playground in the preschool, and you can stay a little longer and ask a parent to stay a little longer in the playground. You're going to be outside, not inside a classroom, but they can play and you can talk to this other parent. And it's just the fact that it's closer to the place where it's school, it would help, and then progressively you would get closer. This again is if you are going to stay there. But since you told me that you are moving, and you're moving where your child will start elementary school, I'm going to say the same thing I said to another question that was asked. I would usually recommend parents to move during the summer, not in the very last period of the summer. Move, if you're going to move to elementary school that is close to your house, try to enroll your child in summer camps or in activity where kids who are likely to be going to that school will be going to. And I'll have a meeting with the ESC staff, the special education staff of the new school. If you know exactly where you're moving to, and that's why I'm so busy this time of the year too, having meetings where we introduce the child to the new school. We want to make sure that the week before school starts, that the child can start going to school and meet the teacher. And even now, if you know who the teacher is going to be, to meet that teacher. That is so important. And that is a lot of work because some of the parents of children with selective mutism also have anxiety of meeting other parents. So you're going to be going to a new place and you may have anxiety about meeting other parents as well. And it's work. Some parents tell me it's so hard for me. But the more you do, the less difficult it will be for your child to find an environment. In addition to that, you will be giving modeling for your child. And the more I tell parents, the more you do this outside of my office, the less you will see of me, and the more successful and effective your intervention will be. The only thing is to know how to go about doing this, and that's something that we give training. We train the parents on how to use the skills to talk to their kids in the presence of other children when they first meet them, which is our, like the PCIT skills for selective mutism. But it's just increasing all the possibilities of exposure for your child in the new place. So basically, that's the fear of teachers now, it's gone, there's the school year is gone. So let's create preventive measures for next year. And the book that you mentioned that I wrote is actually, it was written from the point of view of the child introducing herself to a new teacher. And it's a way to introduce the topic of selective mutism to that new teacher. And that's exactly the age of Sophie is 5, is when she's going to kindergarten. So I wrote for a reason, because that's when they usually change schools or something like that. So use that not for her to read to other people, but for you to take to the teacher to introduce. It's an educational tool for parents to read and learn from, but also to take to teachers. It doesn't have all the strategies that I'm talking about here, but we can do that in another opportunity. Okay.
Well, what wonderful suggestion. I think your Sophie book is a very good education tool. Just buy several copies and bring to teachers, new teachers every semester, I would say.
Thank you.
Yeah, let me read the Chinese.
Not just the teachers, but also ballet teachers, sports, you know, extended family, anybody.
Mm-hmm. Okay.
I'm sorry, I didn't answer one of the questions,
Mm-hmm.
which is really important. Can I say it now?
Yes, please.
This parent asked about acting silly.
Mm-hmm.
And again, I cannot say what that could be because I don't see the child. I didn't observe the child at school. One of the first things that I do after I meet the parents is I observe the child at school before the child knows who I am, so that I can see these nonverbal behaviors before they know who I am, which I recommend to all psychologists to do that. But the acting silly, a lot of times children with SM actually do not have social anxiety, which will lead into our next question, but they don't have, and they're trying to communicate. And the fact that your child is doing that shows me that the child is really wants to communicate, and it's attempting, it's not frozen like some of the children they become very frozen. So your child is actually communicating. The only thing that I will tell you is that if you think your child is acting silly, that's one of the things that we know. If we don't help children with SM express themselves verbally and communicate and develop this communication and give and take with other children early on, then we're not going to be helping them be exposed to the social situations and learn from them. So they may not grow socially as other children are growing socially. So that is why they know how to do it, but they're not experiencing in real interaction. So only with their family or people they feel comfortable with. That's why it's so important to help them be able to communicate. And the silliness could be a lot of different things, but it could be also because they don't know how to go about doing it, and it's difficult for them to express, but they want to let others know that they want to participate.
Okay, thank you so much. It takes an expert with lots of experience to understand what the kids are thinking and what the silliness is meaning. Thank you so much for your advice.
Thank you.
The sixth question is, what if my child is bullied at school? So the parent asks, my child has SM, speech delay, and social phobia. He is too nervous to talk to more than half the kids in his class. When he gets bullied, he couldn't even move his legs to walk to the classroom. He could only talk to people when his parents are with him. The question is, what should I do as a parent to help my child?
Thank you for your question. You are describing a child that we see quite often that just do not just have selective mutism. They have what we call comorbidity or other conditions. Speech delay is quite frequent, or a speech disorder, speech articulation, even if a child spoke early and the child may have speech articulation, language difficulties also. So that's a comorbidity, and I will get to that. Social phobia is another, social anxiety, it's another area that goes with selective mutism, not necessarily all the time, but those three together make the situation more complex, and we need to address all of them. That's why in the beginning I said that I don't approach every child with SM the same way, because there's a huge difference in this child here and the child who acts silly at school, for instance, or who has no articulation or speech difficulties. So I don't know the age of your child, but it sounds like your child is really freezing, in terms physically freezing, which is the extreme of, the social anxiety is acting there too. So the anxiety is very high from the nonverbals that you are describing, but I cannot come to a conclusion specifically about your child. But because of that, we need to, first of all, the question comes, how do you treat the speech delay and any speech difficulties that a child may have when a child may not talk to a speech therapist at school? So we have a solution for that. And we have a wonderful professional in the SM world, in in this area who is a psychologist and a speech and language therapist. She's a professor, Evelyn Klein. She's in your area in Pennsylvania. So she developed a lot of different approaches to working with parents, training them to assess the child's speech delay and speech disorder. But then comes to the treatment. And so what I have been doing in my office is if I know that a child is going to receive, if I don't do a diagnosis of speech disorder, but I even listen to tapes before I see the children, their tapes at home, and I observe them with their parents in a one-way mirror, so I know I can have a sample of their speech, articulation, and language. And if I suspect that they need to be assessed, I will train a speech and language therapist, or I'll bring somebody who I work with well to their office or to their house or to wherever they feel comfortable, and we'll start the approach of that professional with the child. And sometimes they receive the therapy at school, but it has to be with somebody who knows about SM and who is trained to work with children. So how could I just work with the SM if the child is afraid to speak, because the child may be aware that he or she has a speech, they talk differently, and that's one of the fears that the children have, that they're going to laugh at me. So that's why it's so important to include a speech and language therapist, but in the context of the treatment of selective mutism, not just refer, but together. Now, he does talk to half of the kids in his class, so that is good because you can have an intense exposure of play dates during the summer, or and you should do it not just in your house, you should do it at a public place so that this child gets exposed to other situations too, because he has social anxiety. Now, he could only talk to people when his parents are with him. I would kind of do this, and then I would kind of start going out. I had a child who was doing that, was just talking to the parent in my presence and then talking to me only when the parent was present, but then started going out. I asked the mom to step back and not look at the child. And it was hard for mom and dad to do that because they were always looking at the child. I know your child anxiety makes you anxious and the apple doesn't fall too far from the tree. But if I were the professional, I would be working with you to help you be less anxious about your child's anxiety, because it's very likely, and I did research, children with anxiety, the parents are very likely to have anxiety, one of them at least. So the other part that I was going to tell you is that I would say that because of this situation where you have so much comorbidity, which means other conditions, I would definitely seek help from a professional. And if your child is older than 6 or 7, I would definitely include a physician in this process too. Because if children wait a long time to receive treatment, they may create tremendous chronic anxiety. And then we need to have some other interventions to help respond to the treatment. And finally, bullying is something that I don't know if you live in the States or if you live in another country, but there are anti-bullying laws. And not that that doesn't happen, and happens, bullying happens, everywhere. But if you live in a place where there are rules and regulations and there's student handbooks and all that, where bullying is not allowed, then you have to go to administration and you have to ask them to respond more aggressively to that. Selective mutism is a condition that is a silent condition. So the child doesn't complain, and it's very easy to bully a child who is quiet because the child doesn't have a way to defend him or herself. So I think that it's really important for the school to participate but at the same time, more reason for your child to receive treatment. The older the child, it's really very urgent. We really need to work with that, because we know from reports of teenagers and other kids who were diagnosed later that there is tremendous depression, tremendous despair, and such a painful situation every day that goes by. So I urge you to seek professional help, whatever you are, from people who are treating this. And if you need any help in finding, you can contact the association, or you can also email me, and I'll try to see if there is anybody in your area.
Thank you so much. I know that this parent, I think it's a young child in China, and that's why early intervention is so important.
Yes.
We need to help young child to know how to deal with bullying before they become teenagers, when the problem become even more severe. And really feel for the parents and the kids in China. Right now, there are not a lot of professionals like a speech and language therapist that can help kids with a comorbidity.
I would recommend, if this child is young, if there isn't a child psychiatrist in the area, to see a child neurologist who usually has recommendations for speech and language therapists. And I would love to, be part of training other professionals in this area of SM, to help them approach and do their job that they do in a way that will be more effective.
Thank you. Our seventh case is about my child isn't making progress in certain situations and what to do. Question is, my child is nearly normal at school, but does not make progress in extracurricular classes. The teacher made a lot of effort, such as playing with my child after class, but still she does not want to follow and couldn't make much progress. What should we do in this situation?
Thank you for your question, for sending the question. When I read this question, first of all, I don't know the age of this child, and that would make a difference if you know the age. Second,
Elementary age.
Huh?
Most of the parents in our groups are elementary school or preschool.
Okay, that's good to know. And probably if they mention that is in preschool, it's probably elementary school. So I think that, I'm going to go back to the word normal. What you were saying is that your child is almost functioning like other children at school, if that's what you mean. Because it could mean that your child is being able to do everything, but now still not talking, volunteering information, or initiating interaction with other children at school. And that, to me, is still not functioning as other children. So I would have to observe this. But your concern is extracurricular classes. And I don't know your child, but I can tell you that a lot of children with SM are perfectionists, and they need to know exactly what they need to do. And sometimes they respond better to exposure exercises when they are structured. I have an example of one child who, during circle time, this child is almost 5, is going to kindergarten next year, academic year. If they are talking academics, like tell me what letter comes after B, or what comes after 10, count to 7, they will do that. But if you ask, how was your weekend, which is an open-ended question, which you don't like to ask, or if they say something that it's less structured, then they will not answer, and they will not volunteer information because of different reasons. It could be anxiety, it could be a speech and language issue, but sometimes if you have extracurricular situations where the child is not so unstructured, but structured, even an art class could be more structured, or, you know, something that will still be interactive, but it will be less unstructured. Even when you have a play day, some kids don't do well if the parent just invites another child. So sometimes the parents set up like an art project if it's a girl, or sets up something. I mean, boys like to do art project too, but it's like something that your child likes to do, but that has kind of a structure. That is the only thing that I could tell from the very little information that I have. So I would say that you should put your child in an extracurricular activity that your child likes the most. Remember the elements that we talked about, activity, but that is more structured. And then slowly you take the structure out. It's hard to tell, but that's the only thing that I can suggest given the little information that I had.
Thank you. I hope the parents will have an aha moment. So that is my child, perfectionist. Don't need to
I really hope so, and I love the feedback too.
Okay, thank you. In case 8, the parent's question is how to help my child to start talking in a certain situation. That's pretty general. The question says, my 8-year-old girl can talk outside of her school, but at school, she still cannot talk. She worries that people will laugh at her if she talks. What should we do to help her start to talk?
Thank you for your question. This is a very common situation. Many children, the minute they're in the car with their parent, the minute the parent turns around, or if they're walking to school, boom, stops talking. You're nodding, right? It's very, very common. So basically, if your child, your girl is talking outside of school, is she talking to the teacher outside of school too? Because many kids will talk to the teacher outside of school, but she may not be talking to the teacher outside of school. It may be helpful for the teacher to go visit the parent and have some tea in China, or coffee if you are in Brazil, or, you know, and just visit and just be there. Because if the child is talking freely in other situations, let's put the person that is difficult for the child to talk to in that situation of more comfort, and also doing an activity that the child has. Like I had one child who, by coincidence, they saw the teacher at a park because they live close by, and the teacher has 2 dogs, and the child loved dogs, and the child was so drawn to the dogs that she even forgot about the fact that she was talking to her teacher at the park. So that's the kind of situation. Now, I would say call more people to your house, and let's start moving the situation to the school, like to the playground, 8-year-old, you know, or somewhere closer. Now, the other thing is, because you have an 8-year-old, it's an 8-year-old child can do a little bit of the cognitive behavior therapy already. And what she's saying, that she's afraid people will laugh at her, we usually don't ask, what are you afraid of? Because it's very difficult to change the child's mind. But we ask, you know, if she's telling that she is afraid that people will laugh, we're going to challenge that thought that she has, which is only based on her fear. Then we work with her in cognitive behavior therapy. Where did you get the facts that your child, that the kids are going to laugh at you? So if the child likes science, we play science, or if the child likes investigation, we play detective. So we're going to collect data, and we're going to say, okay, let's see, when was the last time that somebody laughed at you when you talked? Well, didn't, right? Because she doesn't speak at school. So where did you come to the conclusion that this happened? And some 8-year-olds can work with cognitive behavior therapy. So then we collect the data, and we find out we need to go and find out. So let's try exposure. We try to expose, but we will try with a child, for instance, who is outside of school is in the child's class, in the same class, and we say, well, this kid goes to your school. This kid didn't laugh when you spoke outside of school. So what made you think that, so you collect data, you do exposure exercises, and you go along with empowering this child to face her fear and to face her thought that kids will laugh at her by challenging with behaviors. We use behaviors to challenge the thought. But we don't say, well, why are you afraid? You shouldn't be afraid. Nobody's laughing at you. We don't try to convince the child. We empower the child to look for information and data, if the child likes that approach. Most children that I work with who are 8 or older respond well to the cognitive behavioral therapy part of the treatment of SM. In addition to all the other factors that we talked about, bring the teacher to your house, kind of move things around, the combination of people, place, and activity to other areas. Okay, and also bring a video of the child, have the child expose a video of herself to the teacher, and then see the reaction of the teacher. So, you ask the child, did the teacher laugh at you? The teacher said, oh my God, you spoke. We train teachers to not do that. But that's a very good common fear that children have. It's in my book. So it's a summary of a lot of the children's statement. But we'd never ask the question what you were afraid of.
You don't ask.
For younger kids.
Unless they volunteer. What if they tell you that I'm afraid people want to?
You, then we work with them. But because you cannot convince them with your thoughts. It's any kind of anxiety treatment. I'm afraid of dogs, and I can't convince. I'm going to find out what is it about dogs that you're afraid of, and we're going to challenge those thoughts with reality. We go to the internet, we find which dogs are vicious, are they all vicious, when do they bite, when do they not bite. We collect data, and then we expose kids to dogs, the same thing. Okay,
that's very helpful. So this shows that the age of the child make a lot of difference in what kind of a therapy approach
yes,
you choose.
absolutely.
So next time we definitely want to collect some more background information of the child, at least the age.
Yes.
Case 9 is about how to get support from school to provide effective intervention. Nan's mom is in Australia, and she asked, my daughter's school does not support me to provide intervention to my SM child. The teachers also doubt if the intervention would actually work. I asked the teachers to interact with my daughter, which the teachers tried, but my daughter kept silent. The teachers have no idea what to do. So Nan's mom's question is, what should I do to get support from school to provide proper intervention for my child?
Thank you for your question. I don't know the laws in Australia. Here, what we do, once we give a diagnosis, we write a letter. I write a letter with the diagnosis, and the parents submit it to the school. And I also ask the pediatrician or the child neurologist or whoever else is working with the child or psychiatrist to write a letter as well. Usually the pediatrician writes the letter after I send my letter to the pediatrician to help facilitate the process. Once the letter is submitted, I follow up because selective mutism is a disability. It's a disability because it affects and impairs the child's functioning socially, emotionally, and academically at school. So by law in the United States, the team of professionals have to meet to develop a special plan for this child. And if they don't, they're not going along with the federal law in this country. Again, I don't know what the law is in Australia, but I would definitely keep track of all the communication I have. I would look for some help in Australia from professionals or universities that could work with this process. I happen to know a professional, but Australia is a very, I don't know where Tony Atwood is, ATTWOOD. He is a very well-known psychologist who works in the area of autism spectrum disorders.
Mm-hmm.
And he definitely has done work with autism as a disability in Australia. He's one of the best people in the social skills area in autism in Australia and worldwide. So he could be a good reference for this person. So if you want to email me, I can send you his information, or it's TONY,
Mm-hmm.
and it's ATTWOOD, Tony Atwood.
Mm-hmm.
He has written several books on social skills training for autism.
Mm-hmm.
And I'm not saying that you should talk to him because of autism. He has done work about autism in terms of a disability in Australia. So I'm sure that he could be a connection for you. And it is my recommendation to you, because I think that it's either the experience with one school or the experience with all the schools. But like I said, for another parent, if you think that another school will be more open to interventions and to training of the teachers, that would be good, because teachers are teachers because they love to work and do what they do. So if they don't want to, or they have no idea what to do, they must feel very helpless. And I think it's our job to help them develop those interventions that we know work. So let me know if you need any help. The language is English. So
Okay, thank you. So I might write you to find out more information about Dr. Atwood. I know for a fact that many parents in our parent support group are not getting professional intervention. And some of them believe that their child has another severe case and they will do the intervention themselves by learning some strategies that they learn online from other parents. So probably you can comment on how professionals can, the words can carry more weight when dealing with school officials.
Oh, yeah, absolutely. It's just not like professionals need to know how they can help. I also work in the area of ADHD and, of course, autism and Tourette syndrome, other areas, neurodevelopmental disorders. And we know that if we go to school, if you have a parent going to the meeting at school, that it would have a professional.
Mm-hmm.
It helps in the meetings, like in this country, IEPs. I go to several IEPs. As I told you, I was at an IEP meeting today. So that is really helpful to have a professional. But on that note, I think that parents receiving information from other parents and having support from other parents is really important, because you don't feel so alone, and you exchange information in a way that then you're not spending money on that. Having said that, I think that we need to know where parents are receiving information and going for information. Your association is, you are talking to professionals in this area, and we're having all kinds of professionals talking to you that have experience in this. But it's really important not to go to any place in the internet, because there are a lot of adults with SM who recovered or still have it. And some teenagers go to some of the chat rooms in this, and it's not a very helpful experience if they only go to that, because it's really, there's a lot of misinformation from other adults, from parents and all that. And especially when it comes to the topic of medication. I don't make recommendations for medication, or I do make recommendations as a professional when to refer for medication, but I don't say what kids should be taking or not taking, or what kind of vitamins they should take for SM, like a lot of people say that. I think that we need to look for professional guidance when it comes to real treatment. And if a parent wants to start with support from other parents, that's great. But I will tell you that every day counts. And every day that a child doesn't go further even if a child improves, but it reaches a plateau, is not good. We need to keep on going up to functioning well in all kinds of situations and with people. So I hope I answer your question.
This is very helpful. So every day counts. That's the important message we want to give to parents. Thank you so much. Dr. Joffe, this is our final question. Case 10 is about how to prepare my child for traveling and to meet relatives. Hannah's mom is in Chicago, and she asked, my SM daughter is 7 years old. She did not show SM symptoms when she started school around 3 years old, but she was anxious with abdomen pain when going to school. Her words gradually disappeared after she went to a new daycare in the new city. She was 4 at that time. I did not pay much attention and I knew little about SM. When we were visiting families and friends in China that year, she talked to everyone. When she was 5.5, she immediately got worse when she went to a new elementary school. She stopped talking to grandparents when they visited us. After a year, she went to China again, and she was still active and did everything normally, but she did not talk to anyone. A few months ago, I suddenly got an idea. I asked grandparents to teach her Chinese, reading and writing through video calls. In the beginning, she could not talk, but soon she opened her mouth to call grandma and read the words. She has been feeling much better talking through video calls. She told me she can talk to them when she sees them in China. I am not that confident. So Hannah's mom's question is, I am planning to visit China again this summer. What else can I do to prepare my daughter for a visit and make her even more confident to make the best out of the trip? Thank you.
Thank you. I love this question for many reasons. First of all, I am a grandmother of children who live overseas who speak another language and English. One of them speaks English, the other one is learning. So I totally can empathize with the grandparents. So, but the apple doesn't fall too far from the tree, meaning you are very concerned, and you are concerned about that. So we need to make sure that you don't show that you are concerned, because kids with anxiety absorb anxiety from their parents. But with that in mind, I think you had a brilliant idea about the teaching of the reading, and what bright kid, learning to read and speak Chinese online. I will tell you that one thing that I will relate to this is something that I forgot to mention in a previous case where a child didn't speak at school but spoke outside of school. Some children with SM, and it comes from my research and a few other pieces of research from Europe actually. Some of the children, not all of them, have a tendency to say all or nothing. Here I speak, there I don't. I speak here, I don't speak here. So when your child goes to China, well, I'm not going to speak there, but then I speak there, and then I come home, and it's like switching codes. That's even like switching codes is a term in linguistics and anthropology, like where do I belong here? So it could be that going on, but what you did is you really you really developed a bridge between those two worlds that were so separated. But you brought the grandparents on the video, and she's learning Chinese, you know, which is not the language where she's learning at, which is, you know, she's here and she's going. So it's really interesting how you were able to, with this strategy, I love it. And I think I want you to tell me more about this. But what I would like to suggest in this very brilliant idea that you had is increase the frequency of those videos as you get closer to going to China. Number one, if you're doing once a week, do twice a week, do every day, you know, like, so that you have more. And then you have to help the parents, your parents, the grandparents, not be like all over your child when you get to the airport, if they go to the airport. Like, how are you? You know, like, of course, I'm a grandparent, so I know. Um, it's like you have to wait for the child come to you. I would bring one of those books that you're reading with the child to the airport and give it to the child, and just not ask her any questions. The grandparents should learn a little bit about forced choice questions and not just let the child approach you. And this is so important. Any work with any child with SM, you don't want to be in their personal space. They're very much, if they have that type of anxiety. So the grandparents should be trained in forced choice questions. And I think that I would have those books that you're reading or this material, just give a little bit when they come, so that that's the bridge that you develop. And it's just a beautiful story. I think and I can't wait to hear what happens in the next chapter.
Oh, what brilliant suggestion. I think it's very timely. So we will translate this right away, and so that our parents can have it before the summer starts.
Yes.
Thank you so much, Dr. Joffe. You've been very, very generous and so helpful with your expertise, and our parents will really appreciate your wonderful, wonderful suggestions. Thank you so much.
Thank you very much for having me, and I would love to hear their feedback if this was helpful or not, because I think that I'm here to help, and anytime I'll be glad to do that. Thank you very much.
Thank you so much. Okay, bye. Thank you.
Bye-bye.